Have you ever noticed a change in your mucus? Perhaps it seems thicker or stickier than usual, and wondered if it means something more serious is happening with your breathing? It is a common concern for many living with a lung condition, and it is smart to pay attention to these subtle shifts. Yes, thick phlegm can absolutely be an early indicator that a chronic obstructive pulmonary disease flare-up, also known as an exacerbation, might be starting. Recognizing this change early is a crucial step in managing your COPD effectively and preventing symptoms from worsening. The reason your phlegm might become thicker or stickier is often related to inflammation or infection in your airways. When your lungs are irritated, either by environmental factors or a developing infection, your body increases mucus production as a protective response. This mucus can then become thicker and harder to clear because of changes in its composition, sometimes due to dehydration or the presence of inflammatory cells. In COPD, your airways are already sensitive and narrow, making it even more challenging to expel this denser mucus, which can then trap bacteria and further fuel inflammation. If you notice your phlegm is becoming thick or difficult to cough up, there are some important steps you can take. First, stay well hydrated by drinking plenty of water, as this can help thin the mucus, making it easier to clear. Continue with any prescribed airway clearance techniques you normally use, as these are designed to help mobilize secretions. It is also important to closely monitor yourself for other symptoms, such as increased shortness of breath, more frequent coughing, wheezing, or fever. If these changes persist, worsen, or if your phlegm changes color to yellow, green, or rust, contact your healthcare provider promptly for guidance. Understanding your body's natural defenses is key. Your lungs have a defense mechanism called mucociliary clearance, which involves tiny hair-like structures called cilia that sweep mucus and trapped particles out of your airways. In COPD, this system can be compromised, meaning thicker phlegm is even more likely to get stuck and create a breeding ground for infections. This insight highlights why early observation and intervention are so vital. You are not just managing a symptom, but actively working to prevent further complications. Being proactive about changes in your phlegm consistency empowers you to take control of your lung health and helps prevent a minor change from escalating into a more severe flare-up. By staying hydrated, practicing airway clearance, and knowing when to reach out to your doctor, you are actively participating in your well-being, keeping your breathing as comfortable as possible.